Hi everyone, welcome to my channel. In this video, I'd like to show you a series of periapical radiograph and a panoramic radiograph of a patient with rampant decays and multiple retained root tips. So looking at here, we're seeing multiple root tips in the posterior right maxillary area. So here we see root tip right there and there, as well as here and here. If you pay close attention, you can also see that there's a periapical radiolucency. Since we're here, I can also make a comment on anatomic landmarks. This thick radiopaque band or entity represents zygomatic process of the maxilla. This is the inferior border of the zygoma, and this thin horizontal line represents the floor of the nasal cavity. So now let's go over here. Again, root tips in the maxilla, anterior maxilla, 7, 8, 9, and 10. Looks like number 10 has been endodontically treated. Now let's look at the anatomy. This thin radiolucent line that extends superiorly represents the intermaxillary suture. This radiolucent area represents the nasopalatine foramen, and we can see the nasal cavity or the nair. Now let's go over here. Obviously, again, incisors with severe decay and the retained root tips. As I adjust the contrast, I hope you can see that there are multiple radiolucent channels or lines that extends in the superior-inferior direction. And these represents nutrient canals. Okay. Now, looking at this radiograph, again, multiple retained root tips here as well with large periapical radiolucencies. I want to make a quick comment about the bone density and the pattern of trabecular bone here. I hope you can recognize that the bone density shown on this in this PA is markedly sclerotic, very dense. You don't see marrow space very much so at all. That also helps us to better visualize mental foramen. So this is the mental foramen, hence that's the mandibular canal, and this is the incisive canal. So mental foramen. Look here as well. Don't you think the trabecular bone is way too dense? That is absolutely correct. Let's look at panoramic radiograph of this patient. Again, we can see that for the most part, the tooth-bearing area of the mandible is markedly sclerotic. And if you recall from my class, you know that it's due to persistent, long-standing, chronic inflammation, right? So this inflammation is what's causing the trabecular bone to be highly dense and sclerotic. We did not have the PA previously of the maxillary molar, probably number 14, but you can see that this tooth has been endodontically treated, severe caries along the root surface and along the CJ, plus the crown that you see looks like a stainless steel crown. It does not seem to fit very well with the margin of the tooth. Not only that, you can sort of see through the crown itself, right? So that's a very characteristic presentation of a stainless steel crown. Look at the morphology as well. It certainly doesn't have that detailed anatomic morphology. So yes, multiple retained root tips throughout the mouth and chronic inflammation causing the sclerosis of the trabecular bone. So that's what I wanted to show you. I hope this was interesting, and if you're If you learned something new, please like the video, and if you're new to my video or channel, please subscribe. And I do my best to update and come up with interesting cases on a weekly basis, so please subscribe. Thank you very much, and I'll see you in the next video. Bye.